We begin the quiz with the general round where 6 general questions from different topics and areas of oral pathology will be asked. The question will be same for each of the participants. 10 seconds will be allotted time for each of the participants to answer the question. The one to answer correctly will get 10 points and there will be no deduction for the wrong answer. The teams will write the answer and send it to the chat box of the admin. Here in this sample question, Team A and Team B gets 10 points for the correct answer and Team C gets 0 points as he has got the answer wrong. The second round will be choice round where there will be 6 topics that a participant can choose from that he or she feels comfortable with the topic. The topics for this round are: A. Developmental anomaly and developmental conditions. B. Odontogenic cysts and tumors. C. Salivary gland diseases in oral cavity. D. Vesiculobulous lesion of the oral cavity. E. Bone lesions in the oral cavity. F. Hereditary conditions. Note, the topics are subject to change, and these are just examples of some common topics. There will be a total of 12 questions in this round. The questions will be asked to the individual team, starting from Team A to Team F and back from Team F to Team A. Suppose Team A chooses topic D for the first time, they will not be allowed to choose the same topic for the second time and need to choose from the rest of the 5 topics. The same rule goes for the other teams as well. This is a passable round where 10 seconds will be given for the first team to answer and 5 seconds for the next team if the question is passed. The team to answer direct questions will be allotted 10 points and 5 points will be awarded to the team to answer the passed question. No negative marking will be there for the team attempting for the wrong answer or passing the question. Sample question: if the team chooses the topic developmental anomaly and developmental conditions. What is an enamel defect resulting from incomplete formation of the enamel matrix called? Answer: enamel hypoplasia. The third round is the visual round where 6 visual questions will be asked. It may differ from a clinical presentation or a histopathological finding or a radiographic presentation. The question will be the same for each team. 10 seconds will be allotted for each question. The participants should write the answer they think is correct in the chat box to the admin's chat head. There will be negative markings in this round for the wrong answer or for the blank answer. 10 points will be allotted for the correct answer and -5 for the blank answer or the wrong answer. Sample question: what is the name of the anomaly shown? If the participant has answered concrescence, they will be awarded plus 10 points or else -5 points for the wrong answer or leaving the answer blank. The penultimate round is the syndrome and gene round. In this round, the clinical features of the patient with a particular syndrome will be presented and all of the teams will have to identify the correct syndrome the person in question is affected with. Also, the question might relate to a clinical presentation along with histopathological features and radiological features, and the participants will have to identify the gene the patient of the disease or condition asked in the question is suffering from. A total of 3 questions, syndromes/genes, will be asked and the participants will have to write the answer in the admin's chat head like the previous round. There will be negative markings for the wrong answer or the blank answer. Sample question relating to syndrome. Which syndrome is associated with multiple COTS, multiple BCCs, calcified falx cerebri, and nevoid basal cell carcinoma? Answer: Gorlin syndrome. Sample question relating to gene. A rare autosomal dominant condition begins in early childhood where both the upper and lower jaw becomes enlarged as bone is replaced with painless, cyst-like growth. In the radiograph, the teeth appear to be dislocated, impacted, and floating in cyst-like space. What is the gene that causes this disorder? Answer: SH3BP2. The final round is the rapid-fire round. This is the final round and a total of 5 questions will be asked to each participant. It is a kind of miscellaneous round where the overall knowledge of participants regarding the subject of oral pathology is checked within a quick period. The time allotted will be 25 seconds and there will be no negative marking for this round. If the participant does not know the answer or is stuck to a particular question, she should pass the question, otherwise the timer will keep running and the next question won't be asked unless some answer or pass is uttered. Each team will get 5 marks for the correct answer. Sample questions. 1. What is the common name for schwannoma? Neurolomoma. 2. What is the full name of the bacteria A. comitans? Aggregatibacter actinomycetum comitans. 3. What is a medical term that indicates the ability to touch the tip of the nose or chin with the tongue called Gorlin sign? 4. What is the motto of the Academy of AAOMP? Bringing together the best in oral health care. 5. Name the condition where there is multiple organ involvement and a butterfly rash is seen over the bridge of the nose. Systemic lupus erythematosus, SLE.